We do send a email out at the beginning of each week that kind of reviews what happened in the previous week up at the Capitol, and it's a little more real time. This is our time to kind of do a little bit of a deeper dive, but there's so much going on, and we can only go into so much information in our Capitol chat. So we are going to try to leave some time at the end of the conversation, but our agenda today is really just kind of give an update of what's going on at the Capitol. Amy's going to do a high view of what's happening with some bills and what's happening with the budget. And then I'm going to have a little conversation about what's going on with the alignment of the Department of Health and DHS. It's going to be a really high view. And then we're going to have some conversation, again, like leave some conversation at the end. So again, we're glad that you're here, and we'll go ahead and get started. So just 4 weeks to go. I know that we're hearing at the Capitol that the legislators want to be out of the Capitol and be done with their work at Easter. So April 19th is the last day, in quotes there. We are at the last funnel, and the list of bills are much smaller, as you know, as it gets closer and closer and more narrow. Beginning of the year, there was over 1,000 bills introduced. There are a little over 200 bills still on calendars to be reviewed. A lot of the committee work, if not all the committee work, is done in many of the bills. There's still some committee work going on for the budget and the tax committees, but it's really time to funnel through the bills and get those out on the floor for debate, which you can watch live each day at the Iowa Legislature. You can kind of see what the calendar is each day. They update that. If you go to iowalegis.com, and you can see what bills are going to be discussed and at what time, and or not what time usually, but what bills will be discussed, and you can kind of find out the debate calendar. There will be some committee work around budgets, and then we are going to talk today about the reorganization of DHS and Iowa Public Health. Really high view, not too many details on that, and then again have a discussion. So Amy, you have a lion's share of the work to do today. So are you ready?
I am. I just put the link in that you talked about. It's legis.iowa.gov, not Iowa Legis, but it's in the link is in the chat. If you wanted to go see some of the bills that some of the action that Bill was talking about. I'm getting confused with Bill and bills, like in the legislature. So we could triple over that. If Emily, if you want to go to the next slide, I'll talk about the first piece is the funnel. So the second deadline hit last week on the 17th. And so this week, the legislature has been busy in debate. In fact, the Iowa House was in until 7:30 or 8 o'clock last night, which was late for a Thursday. They usually try to get home in time so they can do their Friday and Saturday forums. So the House is really plugging away. Senate, not so much. There's not as much going on over in the Senate as there is in the House. It's clear the House wants to get done. So we wanted to flag a couple of the bills and note that our bill tracker below has that information. You can look up all of the current data, all of where they're, all the bills that are still alive are. There was a procedural thing that had to happen today. They had to move bills to a different calendar. They have different, the Senate and the House have different calendars. It's not really that important, except by rule, they have to move some things around, and there were a couple bills that didn't quite make it. So I got to get those out of the bill tracker, but otherwise it's updated. And I wanted to note a couple that we've been following. This week, the legislature sent House File 2167 to the governor. That passed unanimously, both in the House and the Senate, and that defines autism as a mental health condition, which is not a huge change. However, it would make it so that autism spectrum disorder is covered under mental health insurance parity. So that means that they can't discriminate against the services for autism any differently than they do for medical conditions or other conditions. And so that is also might make it easier to get reimbursement for some of that. So that was an Autism Speaks bill. House File 2546, which is The bill that you probably heard about, psychiatric tiered rates. We talked about it at a couple of our capital snapshots, our weekly videos. That basically is helping some of those inpatient psychiatric facilities get reimbursed at a higher rate if somebody's got a lot more complex needs or requires like a lower staffing ratio, so that it would ratchet up on rates as somebody's needs are higher. House File 2495 is something we're really excited about. It provides scholarships for college-based transition programs for 18-year to, I think, 26-year-olds who have an intellectual disability, a developmental disability, or a learning disability. There's currently 2 of these programs. One is NEXT. I can't remember what it stands for, but NEXT, all in caps, at the University of Iowa. And the other one is up in Northwest Iowa at Northwestern College. And I think theirs is NEXT, and University of Iowa programs REACH. And they all stand for something, but it's basically, we have a lot of college scholarship programs for college-bound kids, but not many. There's no scholarships for these college-based transition programs that help young individuals with disabilities have that college experience. So that is moving forward. It's on the Senate floor right now. And right now, I will also note it is in the budget, the House education budget, and we'll talk about that in a minute.
Amy, that's an exciting bill. I was going to mention that we do know just over this last few weeks, Brooke and I have been in a number of conversations with different advocacy groups discussing, the transition when youth with disabilities are graduating high school and what's that next step. And so because University of Iowa and Northwestern has offered an opportunity for people to have that college experience, and it sounds very integrated and really positive. Other graduates from Iowa are eligible for scholarships. People with disabilities have not always had that option, so that would provide that for them. Really exciting, I think. So thank you.
Thanks, Bill. House File 2549, we've talked about a little bit right now, kind of similar to this. Mental health professionals don't have any kind of loan repayment program that like nurses and doctors have. So this is a bill that creates the first mental health professional loan repayment program, so they could get their college loans repaid if they practice in a mental health shortage area. And that applies to social workers, mental health therapists, marriage and family therapists, psychologists, prescribing psychologists, psych, nurse practitioners, physician assistants working under a psychiatrist, and a psychiatrist. So it's a whole range of both prescribers and non-prescribers. So that's pretty exciting. And I also will note that that's right now in the House budget as well. House File 2568 is a bill that started off requiring insurers to cover children's hearing aids and audiological services. Right, Bill and I were both shocked to find out that those were considered cosmetic services, which is shocking. The insurance industry fought back hard on that, and as a compromise, that language now expands the current state funding for it. And so it is a more of a grant application that you can apply to get some funds from the state to help cover those hearing aids, which have to be replaced every couple years as the child grows. So it's not the perfect bill, but it is still giving more options and assistance to families, and they think the funding that's available will be enough to cover the demand at this point. And they're going to keep an eye on that. So it's a standalone bill. It has not been voted on by either the House or the Senate. And the reason it's still alive is it came out of the Appropriations Committee. But it is also in the House budget, HHS budget. So I'm thinking that's probably not going to pass as it's a bill on its own. It's probably going to pass as a part of the budget. Senate File 348, I know Bill Stumpf talked at our last Capitol chat about his work on that, the Guardianship Bill. I think it'll be coming up in the House next week, but there will be some amendments. And one of the things that they're talking about amending that concerns Bill is that right now, there's some enhanced reporting that has to happen by the Guardian to file with annually with the court. So an initial one and then an update. And it has a little bit more detailed information than in the past. And a lot of advocates feel that that information is really needed to protect and really put some guardrails around what a guardian wants to see in the future for their for the individual that they're working with. So there's some concerns that that might get amended and watered down. I think there were also some families that were concerned that they felt priced out of the system because it costs a lawyer more to file that paperwork. But Bill, I think last week said it very clearly that he's trained as a nurse, not as a lawyer. So, and he can fill it out in a few hours. So I think there's a lot of back and forth on that. I will say there's a lot of lawyers in the House, and that makes it complicated. They have their own experiences with that. Senate File 2197 is the bill that we've been talking about, that is the Special Education Task Force. It's a group that's going to get together and look at how do we make sure kids that are in private schools that have the right to special education services can get those services and supports in the school the same way they could if they were in a public school setting. And so that there were some complications around all of the different requirements of education law. So they opted to do a task force rather than, you know, directing the schools to do something. And then finally,
Hey, Amy, just really quick on that one. I just wanted to make, you know, we always kind of talk about how do bills become a law, and usually they start with an idea, and sometimes those do start by our legislators. But this one, I believe, was started by a mom, and a really sincere conversation with her legislator, and then it started to form from there. So the legislator does have to write the initial bill and get that out there, but it's just another great example of advocacy. You know, I know that there are people that have different perspectives on that bill, but that was a family who had 3 or 4 members that were going to private school, and their child with disability was not able to participate in the same school, and just wanted some of those same resources and to follow the family and follow the individual. And you know, and that's how sometimes that's how bills become a law. And so I just wanted to give that plug for advocacy and relationships with your legislators and what a difference that can make, especially if you have a bill that's important to you or a change you would like to see. So
thanks, Bill. Yeah, I forgot to add that point. Senate File 2343 and House File 2526 are the election law changes that we talked about earlier this session. We haven't talked a lot about it because they've just been sitting there on the House and Senate floors. And when I say House and Senate floors, it's the Senate and the House have a calendar that they put all the bills on, and it's a list of bills that are eligible for debate, and they're on the House and Senate floor. So it means they're ready for debate in the House and the Senate. And this election law bill, we're expecting a big amendment. We haven't seen it yet. But we are very concerned about the section that requires you go back to having those 2 envelopes in absentee balloting. So when you want to vote by mail, you'd have to use 2 envelopes, and one of them you'd have to write your voter verification number on and sign it. And if it's not signed and it's not, the voter verification number isn't on it or isn't correct, they won't count. And that's concerning because there's not a lot of time to fix it if you have a problem. And I don't know how many people know that their voter verification number is their driver's license, if they have one. And if they don't have one, there's a number, and it was sent to you in a card. And if you're like me, I don't always keep track of cards very well. And so, you know, I scrounged around the house for my COVID card when I took my kids to get their vaccinations or boosters. And I was like, wow, where is that? So I just wanted to make note that that is something that we're keeping our eyes on right now. We want to make sure that Iowans with disabilities have all the options to vote available to them, and they have time, and that it's not complicated. Emily, you can move on. Because, you know, I will say over the several years that I've been doing these the couple years we've been doing capital chats, I always feel like I got bad news when it comes to budget time, but I'm really excited to be able to actually give some good news for once. The House budgets, there are 10 of them, and you can see that we have 1, 2, 3, 4, 5, 6, 7, 8 of them out. And the House Health and Human Services budget will come out of committee next week, the Appropriations Committee next week, and that's when it'll get a bill number. You can't find these LSB numbers online, so I do have in our capital report where you can find that language and a spreadsheet for that. But that is will be coming out next week. The education budget was the most recent one that came out of the Appropriations Committee, so that I haven't updated that status there, but you can move to the next one. So a couple budgets I want to take a close look at. House File 2575 is the House Education budget that's now on the House floor. And it has some great things in here. I mentioned the post-secondary transition programs, the scholarships. There's $200,000 available in that. And that is contingent upon passing House File 2495. So that means the funding won't be available unless that bill is passed and signed into law. So it is in there to fund that request. There's $4.5 million more for various college healthcare loan repayment programs. I forgot to put the healthcare part in there. So like nurses, doctors. But there's also the funding, 1.5 million in there for that mental health professional bill, that loan repayment program that I talked about, that House File 2549. And that's also contingent on that passing. And there's also additional money, $120,000 for vocational rehabilitation, which I assume can be matched with the federal dollars to draw down more federal dollars. There's another $200,000 increase for school-based mental health through the area education agencies. And there's a $10,000 increase for Best Buddies, which will help them move into some additional school settings. So I know that there were several kids with disabilities and their buddies that came up to the Capitol and testified before the committee to talk about how great a program that is. You can move to the next one. This one's long. There's a lot in it. The House Health and Human Services budget. Again, it doesn't have a bill number yet, but we're hoping to have one next week, and I will post that on our Facebook. I also did post the links to the spreadsheet and the bill on our Facebook page, so you can find it there. But the chairperson, Representative Joel Fry, was very clear that he wanted to focus on 3 things with his budget: building community capacity. So a lot of what the Department of Justice report came out with was we do not have the capacity to serve individuals with disabilities of all levels of need in the community, and we need to build that. Workforce. You can't go anywhere without hearing about the workforce shortage and low wages and direct care and mental health. And so his budget, the House budget, fully funds Glenwood and Woodward State Resource Centers. So making sure that they have the resources to provide proper care for the people that are living there now. 14.6 million for the home and community-based services waiver rate to increase and raise those direct support staff wages That's across all the waivers. 7.4 million to take 250 people off the HCBS individuals with intellectual disability waiver waiting list. 4 million to increase rates, provide more rural home health care options. 3 million for intermediate care facilities for those with intellectual disabilities, a rate increase. We mentioned the psychiatric tiered rates. There's $2 million for that. There's $3 million for child psychiatric rates. So they use the term psychiatric medical institution for children. That's the PMIC. And the service is behavioral health intervention services. So that's the BHIS there. I know there's a lot of acronyms, but some of you may click with you. That's a 36% increase. A little over $1 million for residential substance use treatment rates. 71 million, which was expected to take over the county funding for the mental health and disability services regional funding. So remember last year, the state kicked in half of what is service funding, and this year they're taking over the rest of that. There's also adding some additional services for youth that may have behaviors that put them in the juvenile justice system. That's that functional family therapy to Medicaid. There's also, some people may be aware that the Department on Aging has an Office of Public Guardian that helps do substitute decision-making and acting on guardianships. There's a big waiting list for those services. They put $500,000 in to take care of that. They're going to hire 3 more long-term care ombudsmen. So for those that are living in more long-term care settings, to help, handle concerns or disputes. There's more money for child welfare. There's more psychiatric residencies. And then they have some language in there on the combining of the Department of Human Services and the Department of Public Health. So I know that's a whole lot, but it's exciting to talk about when you add all of that up, how much new investment they're making in the service system.
Amy, I always feel like I have to do that shameless plug of, and I kind of put it in the chat too, to remind people that though that's what's being proposed, knows where the dollars are. It's a great opportunity for you to reach out to your legislator and send just an email that says, really excited about that. Here are my priorities, and briefly tell your story. I don't know how many times I heard this week during debate where people were reading direct emails from their constituents, and so it's a great opportunity to say what you believe or what you think is your priority. That's a lot of dollars there, and people have different priorities, and it's good to share what those are and what they mean to you, so they can move stuff forward the way you'd like to see it. So share your voice.
We could go to the next slide. And Bill, I'll let you take this, and then we'll have questions and have a discussion.
Yeah, so I'm going to do a really high view here, and I know there are probably some people on the call that have a little more even better detail information on my knowledge of the collaboration, or now the joining of the Department of Health, or Iowa Public Health, and Department of Human Services. And so the new title, or as they collaborate or bring those services together, will be Iowa Health and Human Services. I'll say that again because that will be a new term. Instead of saying DHS or Iowa Public Health, will as they start to become one, as they align and become one, it will be called the Iowa Health and Human Services. And so I know there's been some press releases about this. I know all of the staff from Department of Human Services and Iowa Public Health had a presentation this week from Director Garcia. And so when you think about it, just again, high level together, Iowa Public Health has done a lot in regards to education, and they do services. And then DHS has been really responsible for a lot of the programming. They're going to integrate and start to collaborate. So they might be working with one thing that I heard over and over again from Director Garcia is that there would be one door or one entryway for families as they start to get aligned for services, and they wouldn't have to go into two separate type services. So that there's going to take a lot of time to align those big services. And so there's a plan over the years as they become there. But what we'll start to see, and you can see this in the alignment, and it's very detailed, but you might see some divisions or teams or groups or administrators start to move from public health to DHS or vice versa, depending on that alignment. And you can see there are 9 different departments there, whether it's from public health or strategic operations, disability and behavioral health, community access, Medicaid, state run facilities, family waiting lists and protection, and then public health, some of their still aligned that way, and then compliance and administration. And so that's a high level view without getting too far into the details. And we did get, that's kind of where it is, just starting to talk about what that alignment might look like and where those shifts might occur. And so I think there's a lot of excitement around this and starting to think about what that planning might look like for staff. So that's a really high level view. And we can kind of get into some questions there, and I might be able to answer them, or at least I can get back to people in our newsletters if I don't have the answer. So thank you.
I think you hit on the big piece to this, is that our system is kind of scattered around all the departments, and they really want to pull it all together so it's easier for people to get what they need when they need it, and to move across those boxes, because they kind of color coded it. Those service array blue ones in the middle are the ones that they really want to make sure everybody has the ability to access all of that when they need it. And so
yeah, there was a lot of great like examples in the presentation, and I was thinking about early childhood, for example, is that when you have a child and you're and that child's really young, and you start to try to determine what services are needed, you might start with public health because you education and understanding, but then there are services you need to kind of keep moving forward and get the things that you need. And prior to this, they would be separate, and you might be working with a caseworker over here, and you might be working with a caseworker over here, trying to work on those services. And now there would be some alignment, some cohesiveness, and that was an example. I know that that old adage, it takes a village for families, and their hope with this alignment, there would be a lot of cohesiveness in there. So I saw Brooke just unmuted. She might have something to add to that.
I don't know if I have much to add, but I think as people that are that do use both public health and Department of Human Services, this isn't really going to look like a different type of service for you. This is more internally to make things better. I mean, what you should see is a better service system, a no wrong door type of system. So it shouldn't, we really don't think that this is going to impact people that work with these departments and these services, except for in a positive way where they might get access to services quicker or have their education they need in a better format or in better way. So the intent is just to make it more efficient for these two departments to finally collaborate and be more of one agency.
Yeah, I think we can move to questions now. We can always go back on the slides if anybody wants to go back and talk about them specifically, but
Amy, I don't know if you did see, there was one question about Senate File 2197, which I think is a special education task force.
Yeah, that's one we brought up. I'm not sure what Garrett was saying, but I know, I think what, that he had to sue the Cedar Rapids school system. That's when Bill said that this was something that came up because of a mom wanting her child to go to school with her youngest child with a disability to go to school with his siblings at a private school, and the AEA in their district simply didn't want to allow that. And so what there were 3 or 4 lawsuits that they won because they have the right to have those services wherever the child is. And just for whatever reason, there's 1 or 2 AEAs in the state that are just being difficult for families. So they have to take it through the legal system to get services. And so legislators want to stop that. They want to make sure that kids get it and the parents don't have to do the lawsuits in order to get what's right they have the right for. So I don't know if that answered the question, or Bill, if you have anything else to add.
No, I would just say, I know that I've talked to a few families that have had some thoughts on both sides of this. And we really, as the DD Council, really encourage advocacy and knowledge and empowerment. But we stay pretty nonpartisan for those laws and really try to follow what the individual need. And from this case, I heard some really compelling arguments from families that just wanted services to stay with the child. And I think that that's really important. I also can understand or appreciate the other side of that perspective. But in those testimonies, that the example, there was an example where a parent spoke out and was working with the AAA to get services to follow. And then to find out maybe I can't remember exactly, the specific story was that they started to not be able to participate even in collaborative meetings. And so I think what the legislators are concerned is that there is some strife there between the AA and maybe private schools and public schools. And I know that's kind of a political topic. From that end, we're really trying to kind of look at it from that family's perspective. And those testimonies are powerful on both sides. And and I think that's again another example of this is where the bill is and how to make sure your voice is heard from that perspective. But that mom's case, I think, like you said, they had to go through those hoops, and life just in general is complicated enough. We should be collaborating and figuring out ways to collaborate and have services follow people. I think is important. So,
hey, Bill, I think
Garrett has his hand up.
Yeah, Garrett has his name. He's got another name on there, don't you, Garrett? Justin is.
Oh yeah, I apologize for that.
No problem.
It's really me. So I just I'll probably read through the bill myself. This is kind of the first time I saw it or heard about it, but in my experience and just with my knowledge, a child or their family should have those rights and services. And since it's a federal bill or federal law, it should follow that person or a child with a disability. But it goes so deep into the woods that I know personally that others are having issues, like you said, Bill. And I will try to find out who that mother is or who the family is, and then try to work with them, because this is going on in our state, and I know it's difficult, but it through just my case or my personal experience, it's still only funded by, I think, 40% of the federal government provides that. And so and that's for the public education, but with private schools and others, I believe that it should carry over no matter what. So I just want to reach out myself to these individuals, because it's important that they know what is already in existence, so that it can help them down the road, but also work with the state legislators and representatives also because I just feel as though it is something that is essential and key for children, especially, age 18 or 21, depending on the person's disability. But I'm just thinking myself, it should follow suit, or maybe add to their resource of information or just public knowledge, because I feel like there's just people slipping through the cracks, and it shouldn't be a problem, which is kind of a little frustrating or upsetting, because this should have been taken care of. But obviously, some are still facing challenges, which is just unfortunate. But
Yeah. Garrett, thank you so much, because between Bill and I, we'll follow up with you with her name. I think she is assembling, because she did win her lawsuit, and she now considers herself kind of an expert, having gone through it, and the other families that have gone through it. As you know, you get to be an expert once you have to go through the whole thing. And so I think they're trying to get a little group together to be a resource to other families, so they don't have to have that same learning curve that they did. So it would be great to connect you. Oh, you changed your name.
yeah, sorry. Yeah, just that'd be good, just to follow up, and then just to make sure that if this does continue to be a concern or issue, that we just try to help out families and these children, that they get the best education that they deserve, and they deserve to also be active with their peers and whatnot, no matter what school setting it is. So yeah, it's just everybody should deserve appropriate education with the medical needs or the services provided throughout their day. And it's just, I know mine specifically was public education, but you would think that private would also agree to the same guidelines or standards. But I also know it's jumping through all the hoops and whatnot too. So I just want to be an advocate for those families and those children. So thank you. I apologize for taking so long to speak, but just wanted to help out anyway.
That's important, Garrett. Thank you. And we will definitely get you follow up with you, and appreciate your advocacy in that. It made me think of the old days with the DD Council when I first started. I'm not going to say there's some older people on, but there's some people that have been around for a while, like me, that probably remember the old slogan, accessing services shouldn't be so hard, from the Key Coalition. Makes me think of that, because it's like, it shouldn't be that hard, right? Brady, you've had your hand up. Let's go to you.
Hi, Amy. Would you be able to pull up the slide to the House budgets again?
Sure, Emily can. I had technical difficulties on my side.
Okay.
Just 1 second.
Go ahead and ask or do you need to see the?
Okay, so when you're talking about funds for Glenwood and Woodward, would those funds be able to be utilized to assist HCBS waiver programs with Glenwood and Woodward to provide more opportunities to open up more HCBS homes within the community so we could start transitioning clients from the ICF facilities into the community of their choice?
The budget detail doesn't go that far. It just says that it's funding it so that it could be fully staffed.
Okay.
And address any kind of shortfalls that were brought up in the Department of Justice budget. I think the whole discussion about moving into more community capacity is still being discussed. I think it's going to be a multi-year project or process. I do not believe that the Department of Justice, the consent decree will be available until the summer. They're working on it now. And I don't know that we're going to know all the details of what the state's going to need to do. So right now, I think it's just making sure that they have the staffing ratios and everything they need to provide good services there. And then they've invested in these other things for the existing HCBS providers. So if there is a provider in the community that can open up more beds because they're going to get a little bit better rates and can pay people better, then that might be if that 14.6 million helps.
But I will tell you, I can't really speak for Woodward because I've never lived there, but Glenwood has, and this concerns me, but they've been so short-staffed. I mean, they're emergency mandating people every day. And it's just, it really is an issue. People are getting burned out, and they're, when people want to leave and go home because they say, I just had a long day, I need to go home. They're telling them they can't leave because if they leave, then they'll give them an occurrence. And I do agree that the staff shortage needs to be addressed, and we need to work together as Iowans to support those people so that we can get people into the resource centers to work. I know it's very hard for people to say, well, this is going on at Glenwood or this is going on at Woodward. I don't want to work there with that going on. Sometimes people look at the negative, and they need to really look at the positive side of it as well, because they're making a difference for people with disabilities. I mean, they're not there just to be there. They're there to make a change for people with disabilities.
Thank you, Brady. Brady, just a few things to point out on this budget for people, and that kind of gets to your question too, is one is when you think about the fully funding Glenwood and Woodward, part of their budget is their, I don't know the exact term, but their community-based residential programs. They do have some plans to move services out. They have homes that are off campus there or in the community, but they also would like those further away from those units so that there's a transitional program with their services. So again, we don't know the detail, but that's a great question to make sure that people know that also is a priority. I think the other, Brady, this, but keep telling your individual story of how those staff shortages affect, because like Amy said, it is the buzzword at the Capitol, but we are not the only advocacy group that brings up the workforce shortage. There's also restaurants, and there's also, the industrial, and it doesn't mean we're not pitting ourselves against one group or another, but we do need to make sure that if shortages are affecting you or Garrett or other self-advocates, that legislators hear those stories and how that directly affects them. But to Amy's point, I mean, those next few bullets, the HCBS waiver, removing people on waiting lists, the increase in rural healthcare providers, ICFID rates increasing, even the psychiatric inpatient beds or also the child psychiatric beds, those are all community-based services that should see an increase that would allow more services to be provided. But then like Amy said, we don't always see the details. So then I think that's where they start to decide how to spend those dollars. And again, another, I'm always shamelessly plugging another opportunity to advocate, another opportunity for you to share your voice, another opportunity to say what is important to you. And you can do that in a brief, a brief email, and you can find all those links there on our sites. But really appreciate that point, Brady. And I know you have a great way of, telling the actual story, that how it affects you and what you're hearing from staff and how that is, unsettling for someone who relies on 24-hour service. So, Brady, I couldn't, you wouldn't stop advocating if I told you to. So I know I don't have to encourage you to keep advocating, but that your story is so important. So I appreciate that. Thank you.
Thank you, Bill.
And if I could just add to that too, that when these budgets do pass, and it actually goes to the Department of Human Services or to the Department of Education, then to figure out how to implement it if there wasn't that much detail in the actual bill that says how they should spend it. And so there's another, I put that out there because there's also more time for you guys to put input into the Department of Human Services on how you'd like to see that spent. And so I would encourage you guys to continue to go to those town hall meetings they do once a month. There was one again last night. And so I think the next one won't be till the Thursday after session closes, which will be the last Thursday of the month in April. But do attend those and continue to let them know how you like to see their dollars spent.
Yeah, and I posted this in the chat, but I just want to make a note that this is the House budget. So the Senate has their own ideas about how they want to spend money, and their leaders did not give them as much money to spend. So they're not going to have as much money to spend. So somewhere between the House budget and the Senate budget will be what passes. And so if you like the stuff that's in the House budget, you really need to talk to your state senators. And you can do that on InfoNet. If you go to our infonet.org, infonetiowa.org, we have an action center that you can send in an email. I think it's really important that if there's something on this list that you like, to really advocate for it, because we could lose it in the negotiations. So I want to put a downer on it, but it's fun reporting good news though.
Good reminder, Amy. You just you didn't knock me off my feet, but you shook me a little bit there. So good reminder. There's still a lot of work to do, and that's why we have 4 weeks left. We just have till the 19th to keep going, right?
Yeah, the House wants to be done before that week. So they want to be done in probably the second week of April, but the Senate's not moving very fast. So I don't know that can happen. I did just look last night, just if anyone's interested, the earliest the legislature has ever adjourned. I went back to 1984 and it was in 2010, they adjourned on March 30th. So I don't think we're going to make that this year. I love little facts and figures that nobody really needs to know ever, but it's always kind of interesting. I guess I was bored last night while I was watching debate. Garrett gave me a heart though. That's good. Any other questions? Or you want to bring up something that you've been doing and want to chat about? I see Chelsea's on. I'm going to put a plug in here for something I know she's been working on. We're hopeful that the Senate's going to put in some money. I've heard 250,000, but we'd love to see a lot more for home modifications. So for people with disabilities or older people that need some small modifications to their home to make them more livable. We have pretty old housing stock in this state. And so I am going to put up an action alert on InfoNet Iowa. For some reason, I had it up and then I took it down for some reason, and I'm going to put it back up. So if you want to take action on that one in particular, we'll have something up on that. But there's a coalition that's been working to get money established in the Department on Aging to do this home modification program. So if you need a ramp or you need something else in, a widened door or lowering of something, sink or something, that's an option, would be an option. So trying to see if anyone else is on that I know.
I think Garrett raised his hand again, then Brady. Garrett went from a thumbs up to a hand raised, so I think.
So I just have a question, and you can let me know whether you have already talked about it, because I know I missed a few of these updates with capital chats. But could you let me know if can't remember specifically, but I believe it was Senate file 29 65 66 67. Don't quote me exactly, but there was 3 pertaining to other maybe policy still on. She could update too, but I would just wonder if that was struck down or still proposed, or I just haven't looked lately, and I probably just need to take a look at that a second time myself. But I didn't know if you all had that or not.
Can you say the bill number or what it is?
I think it was pertaining. I'd have to look it up again. Like 2965, 2966, 29.
I don't think we have 29, maybe 25. I don't think we're that.
Maybe 25. I don't remember. It's been like a month or two. I'm pertaining to Medicaid and like
Is it the appropriations in regards to budget, or?
You might be talking about the managed care bills that are usually out there.
that was it. There was like 3 separate ones. One was with Liz Matheson.
Yeah, those all are dead.
They're dead. Okay.
There's nothing related to Medicaid managed care that is still alive, other than not just kind of a non-substantive change. Or there is a program integrity bill still out there that would require, and we're not quite sure how it's going to work, but anybody getting Medicaid or children's health insurance program or food assistance, so SNAP. What's the other one? Oh, FIP. So that's the Family Investment Program. So funds for family support. Anybody on those would have to set up kind of a verification system so they can verify your identity. And what it's going to be like similar to when you have a bank account or something where they ask you like your mother's maiden name and your first name of your first pet, something like that. Something that a question you could answer to verify who you are. And they're going to set that up so that you can do it on the phone, on the computer, or in person, or have somebody else help you with it. It's part of DHS moving to integrate all of its eligibility verification programs into one single program. So you don't have to verify your identity and go through all of that stuff with, if you receive food stamps, or food assistance, if you get Medicaid, if you also get the Family Investment Program. It's only one system now. They won't have competing systems. So you'll be able to go through the eligibility determination process and once for all of those programs. So it's something DHS is doing. It's something that other states are doing, and it's probably the least scary one of all of those in program integrity bills that they had. You might remember a couple of years ago and last year they had some bills that were really scary. And if you didn't like respond to letters from these contracted companies about giving them information about how much you earn and verifying your income, and I think they were limiting the number of cars, limiting the, it was some crazy stuff that could have kicked people off eligibility. And I think a lot of groups were concerned about it. I am going to have to go. I know there's still questions, so I'm going to turn it over to Brooke and Bill if you want to keep talking. I just want to thank everybody for
Thank you, Amy.
everything you guys do. I see it. I just want to say I see it at the Capitol all the time. As Carolyn said, her senator has talked about it on the floor about her son's or child's, I guess I wasn't sure if it was son or daughter, child's participation in one of those programs at the universities. That happens all the time, and the more you guys share stories, the more that really helps legislators frame the issue. So thanks for all that you do. Good luck, Bill and Brooke, with the rest of the questions. Sorry, I have to jump off.
All right, Brady, I think you're up. Thanks, Amy.
Thanks, Amy. Have a good weekend.
So I just wanted to share with everybody, and Bill, maybe you could help me explain this too, but I believe it was last month, I was able to go up to the state capitol to advocate and lobby for an event taking place by NAMI for mental health. And I was able to meet both with my Senator Mark Costello and my Representative David Seek. I was also able to meet with the Lieutenant Governor and Governor Kim Reynolds. Governor Reynolds, I feel, was really touched when I shared my story of an individual with a disability that has lived in an ICF facility moving into the community. I am so just blessed that she reached back out to me after our meeting. She sent me a handwritten postcard note signed by her, thanking me for coming to meet with her and addressing the issues that I did. Also, on a Wednesday, in my local newspaper, they did a story about me and talked about about my visit with the governor. So I don't know if it was if this article made public anywhere else in the state, but if anybody would like to view it,
Brady, I think you just muted yourself.
but I put the website www.opiniontribute.com is my local newspaper, and if anybody would like to view my article, please do, and feel free to share it with anybody. So I just wanted to kind of talk about that. I thought it was really neat. And when I arrived at the Capitol, I didn't even, there we go. I didn't even have a scheduled appointment with Governor Reynolds. I tried twice to schedule an appointment with her. And after I got done meeting with Lieutenant Governor Adam Gregg, they said that Governor Reynolds felt horrible that nobody got back to me, but she made time to meet with me. And, that's awesome. I mean, I really did feel like my voice was heard. And we need advocates like Garrett and Hugh and some of the other advocates that might be on this meeting today. We need you guys, because all these different bills that they pass on the state level they wouldn't get the information about these bills if it wasn't for people like us advocating. So
Yeah,
just
thank
as a
you,
reminder,
Brady. That was really an inspirational day, and I love the way, Brady, that you said it that day when we were meeting that morning. You said, I just want to have an opportunity to introduce myself and let her know what's important to me. And I thought that's the most simple way that I've heard. Just the most clear way I've ever heard anybody explain advocacy. Introduce yourself, say thank you, and say what's important to you. And you really shared what was important to you, whether it was the waiting list, whether it was funding for services at Woodward, or whether it was also, you really did a lot of advocacy for mental health and the police department, and just really an opportunity for you to share your voice. And I would agree, she took it, Adam Reynolds took it very serious, and you got to meet with both of your legislators as well and kind of share the same message. And you have a very genuine approach that I think makes them feel collaborative in that sense. So great job, Brady.
thanks, Phil.
All right, well, if you don't have any questions, we can sign off, but I would also encourage people to get our weekly email that we have, and you can send Amy and I and Brooke, you can call it Stump, Amy, Bill, and Brooke, and send us questions, and we'll try to get further more information on there. We really appreciate the attendance and appreciate the engagement that people have had this year. So we will, if there are no more questions, we will say goodbye, but thank you, everyone. Have a great Friday and a wonderful weekend.
Thanks, Phil.
Thanks, Brady. Take care, everyone.
Yep.
Thank you, Jordan.